Everything's recording. Good to go.
All right, good morning, everyone. We are going to start our webinar. We have some participants that are in person in our webinar right now, as well as some of you out there virtual. My name is Mabel Ramirez, and I'm the Director of Quality Initiatives at the Early Learning Coalition, and it's my pleasure today to present to you the story about our Road to Child Outcomes and how this project came to be. So just to check in, if you have any questions on your sidebar, you will see the little section where you can pose questions. Please feel free to do that. I'm going to mute all of you and then open the mic when we break for questions throughout the webinar, if that's okay with everyone. Just hang on 1 second while we have some little technical adjustments. All right, great. Okay, so our objective for today is to become familiar with our RTCO project, to understand its components and who our participants and recipients were of these services, and what was ELC's intentions when we were entering into this project. Our objective with this project was that we would provide, that we would influence the level of quality in our Broward early learning programs through the improvement of children's school readiness skills so that they would have positive outcomes later in their school years. We wanted to make sure that they had rich literacy experiences and that we started that from birth in our infant rooms. We wanted to offer many opportunities for speaking, reading, and writing in the preschool classrooms, and facilitate thoughtful classroom design and planning for each of our children. And most importantly, we wanted to model and instill in our teachers to use reflective and intentional instructions amongst their teachers and staff in their program. All of these were done very, very deliberately, and they were very carefully crafted strategies that would support those best practices we know for high quality programs. It also involved a very selective group of quality materials that would facilitate rich language exchange in the classrooms throughout the day. And this is one of the areas where we're going to talk later about how we measure that. So by the time that a child completes 3rd grade, they should be reading at their grade level. But we have learned that on an average, only half of Broward's children are reading at grade level by the time they complete their 3rd grade. So RTCO intended to contribute to this goal, that children would be exposed to the highest quality teaching interactions and to help them meet or exceed the expectations for learning and development later on in their life. So why is 3rd grade mark so important, you might ask? Well, about 3rd grade is when children are reading to learn rather than learning to read, which is a very important concept that we should understand. We also need to take in consideration that children from low socioeconomic environments have been shown to have the 30 million word gap in their vocabulary, which is a low, a high indicator of low school readiness. So the RTCO project consisted of $13.8 million over a 5-year investment by the ELC using our OEL quality dollars. This project started in the fall of 2013 with an RFP process, and we received response from 3 separate organizations, Family Central, Nova Southeastern University, and Broward schools. Their major vision and components were all the same. The focus was on school readiness children, in other words, children receiving subsidized care. Family Central's model was very similar to Broward County. NOVA was designed to serve the children in the central region of the county. After much discussion, it was agreed that all the participants had the same outcomes and goals. However, their approach was going to be slightly different, with several components that varied one from the others. It provided early care educators with best practices in child engagement tools to use in their classrooms, and it was using proven research-validated techniques that improve kindergarten readiness and children's outcomes. So through the initiative, we selected some research-based strategies that supported that growth, and an implementation model that had a direct, high-quality impact on our teachers. And we must note that this project came with a very robust plan on professional development. So how did we launch the project? So here you can see the map of the distribution by the 3 clusters or groups, as some may call it. The decision was made to recruit based on zip codes of the low-performing elementary schools, with a goal that if we worked with those early learning centers surrounding those low-performing schools, we could actually support the impact and improve those schools over time. So as you can see in the northern side, Family Central had that area, Nova Southeastern had the central region, and then Broward Schools is supporting the southern region of the county map. The priority was to select centers with the most school readiness children. Then again, this project was on a voluntary participation, and we had no incentives to offer and appeal their participation. We are thankful to our partners in this journey, Family Central, NOVA, and Broward Schools, for their commitment to this project. Now I'd like to talk to you about RTO's approach to the project. RTCO had a 3-pronged approach that connected the child, the teacher, and the family. And when I mention teacher, I'm also referring to the child's school. Parents become partners with extended learning experiences at home, and the master teacher uses class to assess the classroom. Teachers use the TS goals to assess the child. The project was intended to surround the family and to respect and honor that parent as their child's first teacher. There is a partnership between the child, his teacher, the school, and the whole family. And there is constant feedback loop throughout the classroom observations and the assessment tools for everyone that's involved. The master teachers provide feedback to the teachers through coaching and reflection. Teachers provide feedback to the family, and teachers also use the results of the observations and assessments both from the child and from their own teacher-child interactions to organize and individualize the learning in the classroom for each child. And at this time, I'd like to stop and see if anybody has any questions before I move on to the actual tools that we used to work with this project. Okay, so we're now all unmuted. Does anybody have any questions so far? Can we continue? Okay. So let's talk about a very important link to our project, which is the role of our master teacher. Our master teacher serves as a mentor and sometimes a coach in techniques very specific to our early childhood education. And she models and uses a lot of one-on-one support. It's a very important component of our project because our master teachers come with vast knowledge and they are certified trained coaches. They have mastered the reliability in administering the assessment tool that is used to track the children's process. And let me explain what that really means. When a teacher is considered reliable in the TS Gold Child Assessment Observation Tool, that means that she has completed some rigorous training and she has passed an examination process that makes her reliable and certified. They have received the support of the program through resource and referral processes, and that's when the teacher becomes a support with the master teacher through inclusion and behavior. They help the family to discuss possible challenges with the child, and they recommend a referral process, and they assist in that referral process to make sure that the child receives proper evaluation and care. The master teachers are also very skilled in parental engagement strategies, and these are very important because we bring learning from school to home just as much as we bring home to school. Master teachers have a caseload of about 20 classrooms, and for those programs which have been with us throughout the past 4 years and are reaching those levels of quality, the master teacher is not as present in the classroom, but is available for consultation and guidance as needed by the teacher. So then we get on to the tools that we used to assess our programs. The CLASS tool is the most commonly widely used assessment that you can use to measure the quality of teaching throughout quality initiatives across the country. It is an evidence-based scoring tool that provides teachers with feedback on a series of dimensions and indicators, and it supports the documentation of the teacher-child interactions. Those results from the observations guide master teachers with coaching, with their mentoring guidance, and also provides constructive feedback for the purpose of revisiting their practice and for planning for improvement and modifications in their lesson planning and their classroom environments as needed. Those indicators that I mentioned earlier, and analysis and coaching plans, they're divided by age groups because we serve infants, we serve toddlers, and we serve preschoolers. So each age group has its own unique class assessment tool that is very specific to that high quality expected outcomes in those classrooms. Research tells us that teachers that are exposed and invested in 2 years or more of training and quality feedback through the CLASS tool have demonstrated consistently improvement in their practice. Our class observation is done twice a year for each classroom and the teacher based on the anniversary date of their last observation. So typically when a program starts with us, they get a class observation, and then they would be observed again at the end and then in their anniversary period after. We are now evaluating what this impact has done to our program. And then we have the Teaching Strategies Gold, which is the assessment and observation tool that we're using to track our children in their development. The TS Gold tool was designed to meet the national best practices for children birth through age 8. It is nationally recognized, it is data-driven, It's very user-friendly, and it gathers data on the whole child. It analyzes its data to help teachers find best approaches for learning needs of each child. And what's interesting about this tool is that it even helps teachers gauge when the child is emerging on a specific objective or goal, and although the child may not be meeting the goal but is emerging into the goal, you can measure that, which is very important because in prior child assessment tools, that has not been able to be measured. It covers 38 learning objectives for building skills such as language, literacy, science, the math, technology, social emotional life skills, and also the child's cognitive abilities. Throughout the year, there are 3 checkpoints that take place in the fall, in the winter, and in the spring. And that's where we can determine the developmental stage of each child, and we reassess our teaching intentionalities based on the needs of each child within the classroom. So children receive individualized lesson plans as well as the classroom lesson plan that is always planned for the classroom. It is seamlessly aligned with the teaching strategies creative curriculum. They belong to each other. But it is also most widely used in other curriculums because of its capacity to complement the most widely approved curriculums. And it supports children that are English language learners. And what I mean by that is children that their home language is other than English. And that's also a very important tool because there's very little tools out there that can manage and measure the growth of children that speak other language besides English. And then we go to our child's first teacher, which is our parents. And the program has a parent engagement component where the master teachers mentor classroom teachers to think about each parent as their child's foremost important teacher. The program staff also facilitate peer-to-peer family engagement support groups, and these are called circles of care. And those support groups have proven to be very effective, and parents really enjoy participating in the circles of care. The classroom activities are also designed so that the family can contribute to the school's learning environment as well as, bringing the learning from home into the classroom as well as the classroom into the home. Overall, we're tracking this information and we seem to have a very active participation throughout. And most of our, all 3 of our partners have already met 100% of this goal in their outcomes measurements. So we use a tool called Mosaic, and that's how we track the parent engagement and the sensitivity to the feedback of the parent participation. So as you can see, the developing of this quality system is quite complex. Over the last 4 years, in year 1, we were very focused on contracting all the staffing that we needed, training those staff, and ramping up the program. The classrooms began, the clusters began to do the recruitment of staff, and they started their trainings. Then we moved into year 2, where the first observations, the first class observations began. Master teachers completed their coaching and certification. There were 433 class observations that were completed, and the first child assessment data became available in June of 2015. Then into year 3, our first full year of implementation took place. We had 412 classrooms that received coaching. We continued our training, and 334 class observations were completed. Our very first class outcome data became available in June of 2016. Then, in this past year 4, We have just completed our full second year of implementation with 421 classrooms that have received coaching and mentoring. We've continued our professional development, and we have collected class data that will be available in July to review. Overall, we've had 141 training opportunities throughout the past 4 years. So as you can see, ELC has made a very significant investment to provide training and technical assistance to the practitioners of our RTCO classrooms. So I'm going to open the mic for questions.
Is the 412 and the 421 unduplicated? So
Yes.
that there's 832 classrooms that have gone through it, or no, there of the 421, some repeated the training?
They're not unduplicated, because remember that our class assessment, we observe the same classrooms over time to see the increase in quality.
Right, but it's receiving coaching, not assessment. So 412 classrooms received coaching.
Coaching, yes.
And then out of that, I guess 334, some sort of observation. And we have 421. So are those 421s completely new classrooms getting coaching, or are some of them getting coaching of the 412 from the prior year? I'm just trying to understand how many altogether we have now.
So the program has a total 421 classrooms over the 4 years, and currently today there's 421 classrooms.
Okay.
So those classrooms are receiving some form of coaching or mentoring.
And it was the intention that classes get double or triple training or some sort of coaching.
Correct. And the trainings that have been taking place have not been the same training. For example, when we first started our RTCO project, the training on the class was on preschool. It was the only training that was available at the time. Over the course of the program, the toddler class observation tool became available, so we started to train and certify our trainers, our coaches on that. And then most recently, we have started our infant class observation training. So there's been a series of trainings. There's been a series of trainings for teachers, as well as for the mentor coaches and their program provider directors. Are there any other questions before I continue?
Maybelle, this is Monica. Just might be a little naive. So, since I'm fairly new to the board, is it all the training done by ELC staff, or and centralized for all the teachers?
So some of the trainings in the beginning were done by the actual creator of the tool, which was the class and Teachstone and Brooks Brothers. Then what we did is we've started to build capacity through the coach, through the master teachers, and we got the teachers certified in being able to do the training locally. And so then from that point on, the master teachers started to provide trainings to the teachers and throughout the program. But there's still like trainings that we conduct here. Carmen is one of our main lead trainers at the Early Learning Coalition, and she is certified in all of these tools. And like 2 days ago, we just completed a master teacher infant class observation training that was hosted, and the trainer was Carmen Nicholas.
Okay.
But in order for us to be trained, qualified to become a trainer in these tools, we have had to endure some very rigorous certification process and reliability examinations. And there's calibration that takes place periodically to make sure that they still have their finger on the pulse of what that training is supposed to feel like and look like. And they have to recertify themselves every year.
Okay.
And not only Carmen goes through that process, but all of our master teachers go through this process.
How many master teachers do there?
We currently have approximately 20 master teachers.
How many? I'm sorry, I broke up for a minute.
20 master teachers.
Okay, thank you.
And they each have a caseload of about 20 classrooms approximately, with some a little more, some a little less, because like I mentioned earlier, if they're in that 4th year or if they're feeling confident in their practice, they don't need the master teacher in the classroom as often, so they do more guidance and more mentoring at a with distance in between their time together.
And just on that note, those 20, we've been able to retain them, so we're not having an attrition rate over the 4 years.
If I recall, there over the last 4 years, we have had a little bit of attrition with our master teachers, but our providers, our subrecipients have been very good in replacing those master teachers with certain skills. Then we've been able to recapacitate them. And
the number is in line with the national norms?
Yes. Yes, the national norm is the attrition rate. Yes, you know, the early childhood has a very high attrition and teachers move around quite a bit.
Just from my education, is it 50%? Is it 30%? Is it?
I don't have the number.
Just ballpark. Greater than 50% or less than 50%?
It's less than 50%, but it's high. It's not what we would like it to be. Yeah, it is high. And it's more in the teacher than in the master teacher. More so in the, yeah. Okay, should we move on? So who have we served? RTCO has touched the lives of over 12,000 unduplicated children and their families over the past 4 years. There's an approximate 1,800 infants within our program, about 3,000 toddlers, and about 7,000 pre-K children. So what have we learned across this journey? It has been a very interesting and very full of knowledge 4 years. We should have set ourselves up as a research project. That is the most overarching thought that we've all had. We did not consider the implications of having the different cluster models. Having 3 different models, we should have really hired an evaluator that could have staged our data collection that would have facilitated the study and the analysis better. The goals were set over a 5-year period versus a yearly contract year. We recognized that we needed to meet the programs where they actually were. So now, best practices is an organizational climate survey that's available that we can administer to the programs to see if they're really ready to take on a quality project in their center, and where are they in their process, so that we can support them. And it'll also make the selection process a lot easier when we take on quality projects like this. We should have built a startup time into the model. As you saw in the timeline, the startup didn't really happen until the 2nd year. We didn't take that baseline data very quickly upon starting so that we could have a contrast. So we had no control groups because we didn't start it up as a research project either. We made some false assumptions that children would attend nearby schools, because as you remember, we were trying to recruit providers by around the low-performing elementary schools, but that was not necessarily so. There were so many variables that we have to consider. It's been very difficult to demonstrate the impact, given so many moving parts. We did not take into consideration that the teachers and the children move quite a bit every year. Outcomes were set unrealistically and we never set quality thresholds. And this is very important that I point this out. In all of the quality rating programs throughout the country, there are some set quality thresholds that are set up so that you can start noting when the quality starts happening. And that's usually about the 5.0 scoring of the class. We don't have to wait till we're a 6 or a 7 to actually demonstrate that we are at high quality. And that's what our outcomes were, that they were all going to be in 6s and 7s. We never measured the administrative quality of our RTCO programs, the administration of the programs, because this is such a high indicator and influencer of high quality in a program, and yet we did nothing for the director and the administration of its program. We should have executed a data sharing agreement from year one. There were no real formal mechanisms at that time. We weren't able to track the children or the teachers. And we really left a very important factor out, which is the health and wellness of our children. Safety, health, culture, and the economy of our community has a very direct impact on how we develop a healthy child. And unless we address all of these together in a very holistic way, we are really never going to reach that road to high quality. So when I mention health and wellness, I'm thinking of, did we teach our providers that, you know, brushing teeth after meals in this classroom is a healthy way of getting a child started to be conscious of its health and wellness? Did we provide vision screenings? Did we provide dental screenings for our children? Did we provide health and wellness opportunities for the family to be engaged in? So all of these things, nutrition, all of these things play a very important role in our high quality programs. So a look ahead into year 5. It's important that we understand that as we look into what year 5 has in store for us, we need to remember that while other quality initiatives have established levels of quality or star ratings, RTCO never really established levels of quality by which to measure our programs. And we must celebrate the increments of growth, no matter how small. And we must also remember that the assessment tools that we're using are supposed to guide decisions, but they're not intended to emphasize deficits. And very similar to other quality initiatives in the country, we've invested in developing the educator, knowing that the investment is reflected on the outcome of our children that takes place much later than their preschool years. And this is something that I feel very strongly about. We cannot look at it as what did that child, what kind of knowledge did that child have when they left our preschool programs? Because what we invested in them, we're not going to see it now. We're going to see it later on when these children become part of our community, when they become lifelong learners, when they excel in college, when they become part of your workforce in your community. So this investment is an investment that you will not see right away, but it's important. And there's a lot of research that says that for every $1 of investment in early childhood, you're going to get back approximately, but the latest research says it's $13. So these are the things that we are doing now in year 5. We're conducting an evaluation. This evaluation is going to be with an independent consultant that will provide analysis of the project to further determine what is the impact on our community. What were its deliverables? What lessons did we learn? What recommendations for continuations they have? What modifications should we consider? And what other sustainable strategies are there that will inform our model, our future model? And of course, the funding and the procurement for fiscal year 2018. We're collecting feedback from providers. We're looking into other quality initiatives. I just recently came from the National Quality Rating Conference, and I learned so much from what other programs are doing and what worked and what didn't work. But they're all very unique to their state because of the requirements of their demographics. We're reviewing best practices across the country and what research is telling us. We're considering very specific populations such as homeless, child welfare, intergenerational. There's a lot of study going on right now with intergenerational and the valuable impact it has not only on the children but on the elderly. So this model is interesting and should be a consideration. We're also going out to the community for feedback sessions. We're implementing our data sharing agreement with our community partners. We're leveraging our data system to analyze our RTCO population. And we're plotting gaps among the centers and zip codes using our GIS mapping. So here's a heat map of where RTCO's presence is. And we're going to use these systems to increase the use of our data through the EFS system that we have internally that allows ELC to match the concentration of school readiness providers in RTCO locations by zip code, and sometimes even by individual providers, so that we can select those providers that want to participate in a very strategic way. The data sharing agreement also allows us to research which schools children from RTCO centers are attending and potentially allowing us to monitor those children over time. The data sharing agreement is also going to allow us to measure the reading levels of RTCO children upon the completion of 3rd grade, which is a very important goal of this community. We want to make sure that as many of our 3rd graders are ready for school later on in life. And we couldn't have done this without the support of the Children's Services Council. CSC has been an instrumental collaboration between the Broward schools and ourselves in obtaining these data agreements to make this possible. Does anybody have any questions thus far?
Again, a naive question, perhaps, is Road to Childhood Outcomes is a, for lack of a better term, a methodology, an approach to deliver on ELC's mission. Is that correct? Would that be correct to say? Yes?
Yes, it's a strategy. It uses some of the best practices around the nation, right? So this specific model may not be in other places exactly like this, but it draws in national best practices and puts them into our unique program for our community.
Having said that, so is there then another guiding principle or another methodology, or how many are there? RTCO is one that ELC Broward has selected based on some criteria. Just from my own knowledge, are there 4 other programs that are out there that sort of do the same thing?
So they're all very much the same. The difference is that some have, instead of master teachers, some have what they call TAs, technical assistants, and they have various levels of knowledge and degree depending on various levels of where the providers are. Other programs have master teachers like we do. But those master teachers, when they get involved, they're also helping those centers become accredited, so they have additional knowledge in accreditation and facilitating that process. But for this part, all of the programs have this concept: the parent, the child, the teacher, the master teacher, and everybody working together.
And I think the other difference is that there are some programs that take this information and give the program a grade, and it becomes a quality rating system, and that providers are paid based on that rating system.
Thank you for that clarification. The second is, have we already decided, ELC Broward, that we are going to continue with Road to Childhood Outcomes for the next 5-year cycle?
So that leads me to our next part of our presentation, our next slide. So what else are we doing? So right now we're looking at a crosswalk between our other quality rating and our quality initiative, which is called the Performance Funding Project, which is also quality dollars. The model is very similar. It doesn't have a master teacher in the classroom. And this year they just added the behavioral and inclusion support to it as intensive coaching as a choice. We're also looking at, should we be considering accreditation at our program's highest level of quality? 40 out of 52 states in their level 5, which is the highest quality, have accreditation incorporated into it. And while we did not put any emphasis in accreditation, I did a little bit of research recently, and interestingly enough, we have had quite a few centers become accredited after that, since being in our RTCO project. Should we take credit for that? I don't know. But it's an interesting observation to know that many more centers were ready for accreditation, and we have right now a number, 15 centers in our RTCO project have indicated to us that they are ready to take on accreditation should we decide to do this moving forward. So the performance funding pilot has a tiered reimbursement process where once the centers participate and they get assessed, and it's a composite class score, the same class tool that we use, they get tiered into levels of 1 through 5, and then depending on where they're tiered, where they fell in the tier, they get a differential increase in the per school readiness child reimbursement. But there's a catch to it. They must have 20% of school readiness children in their program in order to participate in this. So that's something that we're looking at. I have already started to compare what are their differences, what are the similarities, and what that could potentially be. It could be a hybrid of both. The state is moving in the direction of a quality rating system statewide that is the PFP. They get closer and closer to making that decision. And for me, accreditation is a very important piece to a high-quality program because that gives you that process of continuous quality improvement, which is where you can sustain the quality of your investment dollars. Some programs, will go through quality rating programs and they step out of it, and if you go back a year later, sometimes they didn't sustain the quality of the investment that you made in their program. So the accreditation piece holds them accountable and maintains and helps them sustain that level of quality, so your investment is not in vain. And so in November of 2017, we'll be able to share data from all the evaluations and data collections that we have talked about in earlier conversation. and we'll be able to have the results of our independent evaluator to share with us what they have learned across their analysis and study with the community. And we'll have the data sharing collection results from that partnership between the Broward schools and Children's Services Council. So we have a lot of work ahead of us. We have a lot to do. We have learned a lot, and I'm very excited about what the future brings. And I really thank you for your participation today. As Bill Gates would say, the first 5 years have so much to do with what the next 80 years will be. And we will also bring just a note that in November we have slated in our timeline in preparation for after year 5 recommendations of what we believe that our quality project should look like moving forward. Does anybody have any questions?
Nope.
No questions.
As you'll get used to me, I always have questions. I guess is a little bit to define the role of the board versus staff, for lack of, I don't know what the right term is, and balancing a board and operations is always a challenge. So I guess is to understand from board members that are attending, past board members or current, is what is the role of the board in this important initiative, so that we're clear going in. You know, here's the line. You know, here's where you board trusts staff, and here is where staff expects something from the board. So do we have clarity? Because we're at an important crossroads, and I just want to be clear because I don't want to get annoying to staff, but at the same time understand that this is, you know, last year it was $14 million that we spent over 5 years. And so I'm assuming it's going to be that plus a 5% increase or whatever. So it's a big amount of money. And more importantly is we're impacting the lives of kids. So I take that seriously as a board member, but I want to have some clarity as to, so does anyone have insights, and other board members can add their comments and thoughts.
Well, we're through this process, we're going to be very transparent with what we're finding, what we're learning, and what we're thinking about. We're going to be heavily relying on our audit committee to hear what we're finding and some of the other possible ideas for initiatives that we have. And then we will be having, again, a few open forums where that's an opportunity for anybody in the community, including the board, to kind of hear suggestions and make suggestions. We're certainly open to our getting, you know, suggestions from our board members. But of course, in our timeline, we've slated November, I believe the date is November 2nd, we have a board meeting where we're going to bring all of the recommendations. First, it's going to go to audit committee first, then it's going to go, we'll bring it to our exec finance so they can hear about it and weigh in on the budget of said new idea, and then it will go to the full board for a vote. But and if needed, we are open to having more sessions like this where we provide the data and we take questions and we review other possibilities for initiatives. What we're starting in September are info sessions on various initiatives that we're doing here at the ELC, and one of the first ones is talking about the performance funding project that we already have in place. It's funded through OEL dollars, and it's a small initiative. It's been small. It's $15 million for the whole state. But this year, in past years, we've had about 20 to 25 participants. They approved us this year for 100 participants, so it's a humongous increase for us. But it's a tiered reimbursement plan, as Mabel explained earlier. And we're going to present that to board members who are interested in attending this info session so they can better understand that program. And it'll help in the decision making for Road to Child Outcomes down the road. If you understand all the quality initiatives from the get-go, when it's time for us to have a conversation about recommendations, everybody will be well informed, which was the intent of this webinar, was to provide just the basics so that when we provide the data and we talk about national best practices and when we talk about what other ELCs are doing and the funding that the quality funding dollars, that everybody will be on the same page and we can have real valuable conversations instead of talking about, I don't understand what a master teacher is. So I hope that helps, but if you need clarification, please let me know.
So my takeaway is that the audit committee, a subsection of the board, will be sort of getting into the nuts and bolts and making having a discussion with staff and then recommendations to the rest of the board.
That's
And
the way
then the timetable. Go ahead.
No, this is Monica. I mean, that would be what I'm hearing Renee saying with the purpose of audit. It's sort of getting a little more into the weeds of looking at all, like having a very deep understanding of the different quality initiatives. So then as we're like looking at future investment, do we keep it at, like a different approaches, or do we really look, with staff recommendation? I mean, I'm always, looking to staff who are the experts to do, but they're having to deal with long-standing partnerships, competing interests of how folks do it, and then really looking to the board to support, and ask the hard questions about our partnership, so that everyone's on like the same playing field. That's kind of like how my perspective is.
Yeah, like for example, that 20 classroom caseload to a master teacher is really high. If I had a recommendation, one of the things I would do is reduce that a little bit. It's very difficult to provide quality coaching with a caseload of 20 classrooms.
We'll be bringing things like that to the table. And again, there's a lot of ELCs that have had quality initiatives in place for many years that have been successful, and we plan on talking to them and not just looking at the initiative, the best practices on paper, but talking to people who have actually and say what works. But we're definitely thinking about, if we have these quality initiatives that we have to do through our funding, our OEL dollars, is it a better investment to just embellish those plans and kind of have one initiative? But that's just one recommendation. But we'll get into that.
And just going back a little bit to data and the collection of data, one thing that didn't help for us was that the school readiness rates did not take place exactly for the 4 years of Road to Child Outcomes participation. So that usually is a quick and fast indicator of where are our programs, and we didn't even have that to be able to measure our children kindergarten ready when they're leaving our pre-K programs. But this year we now have a tool, and hopefully this year we're going to have some good data that we can share moving forward.
I appreciate the slide where you outlined the things that we learned. I think that was a great chart, and one that's, again, not always easy to show because part of the people were part of that, and I know there's been changes. I guess as we look forward, are there things that we can put in ELC's, Broward's guiding principles of operations so that this doesn't happen again? So for example, here, when you read these now, you say, wow, why didn't we think about that? So are there things that we have to put into our ELC board as our values or our operating approach. I don't know the right word. And the biggest thing that comes to mind as I read this list was, did we talk to other people? And what are the best practices, or did we go into this a little bit, siloed and we asked? I don't know, but it would seem that we should have something in our values or that would prevent us from making these mistakes again. And I don't know if we have that somewhere.
Yeah, no, we do. That's an excellent point. And again, I think the bottom line is that, we're implementing a quality initiative, and that takes more. It's not just having recommendations from educators on best practices. It's not just having the data. It's having, first of all, the structure, the appropriate structure in place, and we're looking at that. And it's also, I can sit here and come up with a lot of ideas of what I think we should be tracking. But, my expertise, I'm not a researcher. Yeah, I took research in grad school, but I want to get the right people, the appropriate people to help with those decisions and set us up so that day one we can actually measure what needs to be measured and know what can be measured and realistically what can't. So that is part of our plan. We are using our lessons learned, and in our new model, we are going to work with all types of experts in the field to come up with a plan. And we know, for example, with our PFP, the University of Florida, they're tracking the data. They're using their researchers to track the data. So what have they collected? What information is helpful and what's not? And talking to them about what they've learned, because they're doing it, they're living it, they're breathing it. So whatever our model looks like, whether it's PFP or not, we need to be asking those types of questions. So we will build it into our operations. We know that the model that we have in place in terms of what internal staff we have here, that it's going to look different in terms of who's monitoring the data, because we want people who are experts in education to be focusing on the education and the quality piece, and those that should be following the data and working with the programs to adhere to whatever deliverables there are in a contract are met. Those are different people, different skill sets. So we're very mindful of that.
And also we need to look at, what are we doing for the workforce of the early childhood community? There's a huge movement across the country about improving the wages in the workforce of early childhood, and how can we make that happen? And that has a very direct impact. There's a couple of quality rating programs in the country that did a study about, where did they see the quality? What were those teachers earning at the time when they experienced the quality? There's also a recent study about the impact that having more education did not really have an impact on the quality of what was happening in the classroom. The class scores did not improve dramatically because the teacher had a bachelor's degree. They were getting equal quality from teachers that had a national CDA, for example. So those are all things that we need to consider, and we should investigate more about, the demographics of our teachers when we recruit. And okay. Well, it's been a wonderful morning with all of you. Thank you so much for your participation. I look forward to continuing these webinars of information with the different quality programs we're working on right now. And have a wonderful weekend, everyone.
Thank you.
Thank you.
Thank you, Maribel.